Hello, everyone. Welcome back to How Come. I don't know if you can hear it, but the birds are chirping. It is early as fuck. I am coming to you from West Virginia, and I'm here to say if your week has been fucked up, it's not your fault. Mercury is in retrograde, and shit's just been getting crazy. I didn't think I was going to be able to get this episode to you guys this week, so I'll just tell you about my week. On Wednesday, me, my friend Sarah Armour, my other friend Abby Rosenquist, and our friend Ronnie Lordi, all comedians, went down to DC to do a comedy show. It was amazing. So many companions came. Thank you, you guys. You're awesome. I had the best time meeting everyone. One of our season 1 finale callers, you know how we always on Congratulations have people call in and tell their first time story. She was there. Hi, Mel. Shout out. It was so cool to see her. We were freaking out over each other. And so that show was amazing. And then Sarah says that she has this wedding to go to in West Virginia. And do we all want to go and maybe perform? And initially I was just like, no, I'm not doing that. But, and this is not a call out, but I hope she's not listening to this episode. Someone that we were staying with, my charger went missing. My computer charger went missing when we were packing up to leave the place that we were staying. And I had been planning to edit the episode on the bus on the way back. But then my charger's gone and I was like, I guess I kind of need to stay with Sarah. The universe is telling, and Sarah's really into horoscopes and astrology and stuff. And she does people's birth charts and shit. And as a job, besides being a comedian. And she's like, this is the universe telling you that you have to come down to West Virginia. So I came, and then the second we get on the road, I realize I don't have the fucking file of this episode. Long story short, no, this story's crazy. Why am I trying to jump ahead? Wait, okay. So I don't have the files. I tried to message Alex, our sound guy from season 1. I'm like, can you get over to Nanny's house? He's like, yeah, I'll try. But Mercury in retrograde, Nanny's in the hospital. She's better now, knock on wood, but everybody else pour one out for Nanny, say nice things. She's okay now, but she was in the hospital, and he tries to go over to her apartment. The doormen don't let him up because no one's up there, and they've never seen him before. But he lives near me. That's why I asked him and not Ben first. So he goes, and I'm freaking out. We're in West Virginia in this Airbnb that's 1970s style. It was cute, but it was scary. And I'm like, what do I do? I'm down here. I don't have the files. I don't have any way to access them. Charlotte is gone for the weekend. She can't go do it. And then 2 of the comics I'm with, Abby and Sarah, are like, oh my God, why don't we just record an episode? We have sound equipment here. We can record one. We both have herpes. And I was like, oh my God, you do both have herpes. We do need an STD episode coming soon. But I was like, let's do it. So yesterday we're all scheduled to record this episode. And the plan was they were going to go kayaking. And then when they got back, between the hours of 5 and 7, we were going to record. And then 7, we're supposed to do this show at a wedding. So I take a nap, and then I wake up and it's 6, and I'm like, where are you guys? Turns out they tried to go kayaking, but the instructor didn't bring life vests. So then she was like, I'll take you hiking. She takes them hiking. Within the first 15 minutes, our friend Ronnie gets stung by a bee. He's allergic to bees, deathly. So then he goes to the hospital, and then that's when they messaged me back. They're like, no, we're in the hospital. We can't record this episode. I'm like, what the fuck is happening? Mercury retrograde is so real. And then, in that time, I just Facebook messaged Ben, I guess, cause he doesn't have a phone. So he hasn't had a phone in a month, and honestly, it's been really nice. We'll talk about that another time. But he doesn't have a phone, so I messaged him on Facebook just to tell him what's been going on. And it turns out he's at Nanny's. So I was like, oh my God, why are you? No, he wasn't. He was there to get a file for his like own edit. But I was like, send me this episode. So he did. So this episode's happening. But long story short, Mercury in retrograde fucks everything up. So if you're feeling weird, that's why. It's been a weird fucking time. But yeah, that DC show was amazing. We had the best time. You guys are the best stand-up audience. Like, I obviously know you're a really good podcast audience, but sometimes it doesn't translate. It's like some people, they're not good laughers. They're just there for the facts. You guys are, most of the comics were like, we've never seen an audience like that before. And I was blown away too. And I love you guys. And thanks for sticking around and saying hi to me. It's like my favorite part of this whole thing. Also, exciting news. I don't know if I mentioned this last week. I hope I did. I don't know if I said it definitively, but merch is out, you guys. Yeah. Go to howcomepodcast.com. We've got sweatshirts, hats, mugs, stickers, bath mats, like makeup kits, other stuff. We've got so much stuff, and they're beautiful things. So you guys should go get them. We also on the website have a like shop our partners page. So if you want to go and get a Helix mattress or get a toy from Sweet Vibrations or get some Roman products, we're going to talk about all that stuff on this episode, but we've got promo codes, and they're all on howcomepodcast.com in the shop our products section. You guys will want to get them after you hear me talk about them. I'm going to talk about okay, so the theme of this episode, besides Mercury in retrograde, I think that theme is over. But when we recorded, it was also very early morning. And as you can hear, the birds are chirping. It's like 7 a.m. This is the only time I have today to edit this podcast. It's Saturday right now to me. And then we have to go to this water park. There's a huge fucking water park here in this woods place. It's not a woods place. It's an Adventureland resort that we're staying at, and that we're staying in a cabin, but they have a huge water park. So like, I'm not going to not go to the water park, but I have to also edit this episode and get it out to you guys. So the theme of the episode is early morning, because we recorded with this guy so early. He is like the leading urologist, penis doctor for layman's terms. And you're going to love his interview. And you're just going to hear me pop in sometimes because I didn't want to talk about our partners while we were with him and like waste his time. So you're just going to hear me pop in sometimes and tell you about an amazing product I love, okay? Anything else? Oh, yeah. There's a surprise episode coming this week. It has something to do with a certain show that I love. I guess it's not a surprise because I'm telling you, but a bonus episode is coming in the middle of this week, so get excited for that. And also, hey, thanks to everyone who has joined Patreon recently. I really like you guys. You also get a promo code for merch specific to Patreon, 10% off. So if you join Patreon, you can get that promo code as well. But thank you to these amazing companions: Jasmine, Connie Holben, Deborah Stein, TK, Caitlin Van Houten, Hannah M., Jen Kenyon, Sarah Harbin, Taylor Jarzabek, Louise Douglas, and Nora. Oh, and also, oh my God, you guys, Feel Good Filth. He was a guest, Jim, a few episodes ago, and he joined our Patreon too, and he's the nicest guy in the entire world, and he's making so many people come. Like, we've had so many responses. If you follow the Instagram at How Come Podcast, you should follow it. If you don't, go follow it right now. Hello, guys. How Come Podcast. But we post first-time coming stories all the time, and we had one this week that was first time coming with a hand, and this week that was first time squirting, and one of my best friends this week had her first time ever. Congratulations, you know who you are. And like 3 separate women, maybe even 5, now that I'm thinking about it, said that they were listening to Feel Good Filth or listening to Quinn, are both things that we were talking about on our audio porn episode, and they came that way. So you guys try it out, even if it sounds crazy to you. It's not crazy. We are going to have extras of this episode on patreon.com/howcome. So go there if you want access to these extras. And I think that's all I have to say to you. But enjoy this episode, and I will see you guys back in New York for some stand-up. If you want me to come to your city, message me. Sarah, my friend who I was telling you about, she's really into setting up stand-up tours. And her, me, and Abby are all very funny people. Ronnie's really funny too. But we're thinking about doing a lady tour. So message me on Instagram, either at How Come Podcast or on my Instagram, and tell me where you want to see me come do stand-up. Or if you specifically want to see a How Come live show, like a live podcast recording, let me know. Just keep letting us know. Let us know. All we can do is communicate, guys. And speaking of communication, let's get this episode started. You're going to love it.
How come? How come? How come I can't achieve? How come I can't achieve? I'm rolling up my sleeves. I'm rolling up my sleeves. Oh baby, I believe these guests can help. 'Cause I can't do it by myself. I wanna jizz.
Okay, good morning, everyone. Welcome back to How Come. It is early AF because we are sitting with a doctor who's got a very busy day and just was nice enough to let us come in the wee hours. We are sitting with Francois Eid. He is an MD board-certified urologist focusing on the treatment of advanced erectile dysfunction. He specializes in penile implant surgery and also treats urinary incontinence after prostate cancer. He's one of New York's leading penile prosthesis surgeons and is currently the director of advanced urological care in NYC. Welcome, Dr. Eid.
Good morning, and thank you for having me on your show.
Thank you for doing this. Yeah. We have so many questions about penises because we're mostly talking about vulvas, and I think you're the guy.
All right.
Literally.
I'll do my best.
How did you get into this field?
It's reconstructive, and so I enjoy giving back to people things that they have lost. When I started my career, I mostly did kidney transplant and removed kidneys from kidney donors who wanted to give their kidneys. And it got a little bit boring after a while. At the same time, I was beginning to treat patients for erectile dysfunction and saw that how gratifying that was for men who had lost their potency. You know?
Totally. And your surgeries are like the last-ditch effort, right? After
it's mostly for patients who don't respond to oral therapy.
Okay, so like Viagra, Cialis.
Exactly. Other options are good, but they're not good for the long-term use. You know, so we have penile injections, vacuum devices, and urethral suppositories are options other than surgery.
Injections?
Yeah.
Suppositories.
Yeah.
Okay, so an injection would obviously be
around the side of the penis. Yeah.
Oh no!
That's where the I haven't met. I've been doing this for 30 years. Haven't met a man who enjoys that yet.
No, I don't think. I think that's one kink that nobody is like. I would love a needle by my penis. But you've performed over 5,000 multi-component inflatable penile implant surgeries over the last 27 years, which is crazy because from Charlotte's research, a urologist at other healthcare institutions at large typically only perform less than 3 a year.
Yes.
And he's doing more than 300 a year.
300,
That's insane.
Yeah, but that's all I do. I don't do other urological procedures, So,
but prostate stuff, you do?
I don't do.
Oh no.
No, I don't. Yeah.
Okay, cool.
So I don't even know how to do a prostate biopsy. It's a little embarrassing from urology. Yeah.
We won't tell.
It'll just be on this podcast.
It's okay.
So the guys who are coming in, they're suffering from ED. Are most of them older? Because I feel like I have a...
No. A lot of young patients, about 50% of all the penile implants are for diabetics, and these patients present at, could be as early as 35 years old. If they have insulin-dependent diabetes, juvenile diabetes, they've had diabetes for 20 years, they develop erectile dysfunction.
Is there something in diabetes that makes blood flow less readily
if diabetes is not well controlled, it causes an accelerated atrophy of the penis. The penis will scar down and shrink, and they develop scar tissue. They develop something called Peyronie's disease, curvature of the penis. and it can get pretty significant. So it's very important for them to maintain good sugar control. Unfortunately, many of the patients who have juvenile onset diabetes, they go through a period where they get, it's very consuming to monitor your sugar all the time. It's really
stressful,
very stressful, and it takes a lot of work and dedication, and it's hard for men to keep that up in the beginning, and then they'll settle down when they get into their 30s. But unfortunately, by that time, the damage has been done. And then we have a lot of patients who have overeat. Diet is a big factor. So we have a lot of, depending on ethnic background, for example, Hispanic males who have abdominal girth, they love carbohydrates. And
I'm a Hispanic male. Because I've got abdominal girth and I love carbs.
Yeah, carbs are a killer.
Carbs are king.
Yeah.
So that's interesting that diet actually does affect it.
Oh, yeah.
Because we had a lot of fans writing in asking that question.
Absolutely,
exactly.
Yeah.
There are a bunch of
anything that's white is bad, basically.
Okay.
It's very easy, So you should have only natural carbs, or I think all processed food are bad. Essentially.
Processed foods.
Yeah.
And because they limit blood supply specifically.
Exactly. They damage the inner lining of blood cells, of blood flow of where the arteries are.
And you need blood for
to keep
erections.
To erections and to keep the flesh healthy.
This is going to be the hardest day calling them erections and not boners, but I'm doing it because you're a doctor and we respect you.
It's okay.
No, I thought it was really interesting too, because you do think of ED as an older person's issue.
Yeah,
and I was reading this paper that was saying a lot of younger men do have it, and there are a lot of comorbidities, basically. Like smoking can be a huge issue too. Also like diabetes. And what other kinds of things can lead to it besides diet?
So it's a great question.
Especially in young men.
Yeah, maintaining, some men have bad cholesterol levels, so they were born like that. They have and also we have patients who've had prostate cancer surgery or bladder cancer surgery. Prostate cancer surgery, many men are in their mid-50s when they get that, so they're still considered young. And then those patients who undergo either radiation or surgery will have problems with erections. Fewer than 70% of men after prostate cancer surgery get their normal erections back. So it's, a lot of these patients will need help, and either by oral medication or penile implant.
And you were talking about with the people with diabetes who have to have insulin, how that's like a stressful thing.
Yeah.
Would that stress contribute to ED? Because I think a lot of the times that we think of it as maybe a psychological problem.
It does initially, but if the erectile dysfunction is persistent, most likely it's not stress related.
It's not psychological.
Yeah, that's what I was going to ask also.
Yeah.
If you could just define really the difference between erectile dysfunction and performance anxiety.
Yeah.
Because they are different.
Yeah. So erectile dysfunction is a persistent inability to obtain or maintain an erection that's, will be good enough for sexual activity. Doesn't matter what type of sexual activity. Performance anxiety is sort of the patients have a problem in certain situations. In the comfort of their home, masturbating, they'll have no problem getting an erection. If they're with a partner, then they'll have difficulty, or they'll get an erection and lose it, or get a very anxious and won't be able to have an erection. Very often the patients will know. They'll tell you, I have no problem at home. If I'm watching porn, I can get a good erection. So it's
so that person would not be a candidate for an implant.
No. And then there are some hallmarks of what we call physical organic erectile dysfunction. If a patient will say to me, for example, when I masturbate at home and have an orgasm, my penis is soft. There's no pressure from a partner there. There's no performance anxiety. Then I know that patient is most likely will have a physical problem. So the history is where we tease this out.
Can we describe the implant and what the process of putting it in is like?
So the implant is an inflatable device. It has two cylindrical tubes that fit in the shaft of the penis. And it has a little pump in the scrotum and then a reservoir that we place next to the bladder.
This is the same thing from Sex and the City?
I don't know. Or maybe, yeah.
The one that Charlotte was looking at for Trey?
Yeah, I think so.
Yeah.
That show really has taught us a lot of stuff.
It really has.
Now, it was invented in 1973, so
Okay.
it's been around for many years. It's filled with saline, so it's fluid-filled. And what we've been able to do in the last 15 years is place the implant very discreetly so that the incision is very small. It's only 1 inch big, and it's through the scrotum, so there's nothing to be seen. And we have a lot of patients now that have an implant, and the partner has no idea they have an implant.
Wow.
And so these guys can perform like crazy. I mean, some of them will have sex 4 times in one day. I've had calls from patients in their 70s telling me that they've had a second orgasm, if they say, for their heart.
Wow.
And so it's an amazing device.
Yeah.
And so it feels natural, looks natural.
I was going to say, it feels the same.
Feels the same, yeah.
Because, like, we don't know, I guess we kind of
what
know
it's
the
like
sensation. No, I mean, it's similar embryonic tissue, right? For a clitoris and a penis. When they get hard, there's like more blood flow and stuff.
Yeah.
But we don't know that feeling of like
having something
having
inside.
an erection, having something sticking out.
Yeah.
But it's that same sensation.
It's the same sensation, yeah. Because the sensory nerves are on the skin. There's inside the penis. They're mostly muscle, blood vessels. That's it, and veins.
So it's all about topical once it's already gotten there.
Yeah.
And
so this is something very interesting because we confuse orgasm, ejaculation, erection.
Yeah.
But they're 3 different. Yeah. Totally 3 different. So we'll have patients who have orgasm without ejaculation. We have patients who have ejaculation and they don't even know they have an orgasm. And we have patients that have erections, with or without orgasms. So it's 3 different. Totally.
Well, I think that's for everybody. Everyone, like, I've had people writing me being like, I squirted, but I didn't have an orgasm. Is that possible? Yeah. They're different things. And I know Charlotte read in her research that the orgasms come from the spinal cord instead. Is that what it was?
Or erections.
Erections.
So, like what he was saying, orgasms and erections aren't actually like necessarily entwined.
Totally.
Yeah, exactly.
Because an erection comes from a different system. Like there's in the nervous system. Exactly. How does that work in your body?
Well, it's complicated.
Draw us a textbook. No.
It starts with arousal, being sexually excited, and then you have nerve fibers. It's called the parasympathetic nervous system, which causes the penile muscle tissue to actually relax, and that and it relaxes because there is a chemical which is called phosphodiesterase, which is how Viagra and Cialis work. And that chemical causes the muscle to relax. As the muscle relaxes, the pressure inside the penis actually drops. So it becomes very easy for an artery to pump blood in the penis. So the artery starts to pump blood in the penis. As the penis starts to stretch, there are little cavities. It looks like a sponge, same as what you wash your dishes with inside the penis.
I wash my dishes with a penis.
Yeah. So then what happens is this spongy tissue expands, and at the periphery of the spongy tissue there are a network of veins that get occluded, and that's how the pressure starts to build up in the penis. So for me it's a fascinating physiological sequence, because it's almost like filling one of these tubeless tires, where you fill the tire in the beginning and air escapes from and then eventually it pops and then it traps the air into the tire. So it's the penis is exactly like that. In the beginning, blood flows in and then starts to flow out, but as the penis stretches, it occludes the veins and traps blood.
If the penis isn't working, just pull over to the side of the road. Call someone for help.
Call
AAA.
Call triple X.
Wow. I love how open Dr. Eid is about talking about all this stuff. And like, I know that that's really dumb because that's his job, but like, you just don't think of doctors as being like this cool and open and comfortable. And speaking of comfortable, you guys, I haven't talked about it in such a long time and I miss it so much, especially on this weird Mercury and retrograde adventure. We have stayed at like an Airbnb. I've stayed on a trundle bed. I'm currently on a pullout in a cabin at Adventureland Resort. I miss my Helix mattress so much. I need a good night's sleep and I can't wait to be back in New York. But let me tell you about my Helix if you haven't heard about it already, because Helix, they make the most amazing mattress, and it is especially ordered for you. How do they do that? Let me tell you. They have a 2-minute sleep quiz that matches you to the perfect mattress based on your body type and sleep preferences. The mattresses are customized to your unique needs. No more compromising on a mattress that wasn't designed to work for you. They even make mattresses for couples with different preferences. They split the mattresses down the middle to meet each person's needs and sleep style. They have a 10-year warranty, and you can try your mattress for 100 nights risk-free, and they'll even pick it up for you if you don't love it, but I know you will. How do I know that I love it? I miss it. I miss it more than I miss Ben. No, I miss Ben so much. I miss them both. I miss my mattress and my boyfriend, and I just want to have a proper snuggle, not in the woods in West Virginia. No, I actually really do like it here, but the bedding is bad. My back is sore. My Helix, I am never sore. It's the mattress I always needed but never knew I needed. Like, I always used to think I needed really squishy, cushy mattresses, and then I took the sleep quiz and it was like, no, you need like something a little more solid. Now, mine is the Midnight, and it is so good, and I never wake up sore anymore, and I never wake up sweaty anymore. I don't know why the mattress does that. They're also really good for sex, these mattresses. You can look up that on the Helix website. Basically, they're just like very stable and really good for banging. So if you want your own Helix, and I'm sure you do, this an added bonus is that if you get a Helix, it helps this podcast. Like, a lot of our partners like just give you a discount. Helix actually is such a sweet partner to How Come that they give us a percentage of any of the orders that you guys put in. So thank you to you who have ordered them and love them. I love watching your unboxing videos. If you get a Helix, tag us in your unboxing video and we'll repost it on Instagram. Also, always post us on Instagram and just always be posting us. We love it. But if you want your own Helix sleep mattress, and you do, they're the best. I want mine so badly right now. I miss it. I can't wait. Absence makes the heart grow fonder. If you are missing your Helix, or you have been without a Helix this whole time and you want to fall in love, just go to helixsleep.com/howcome, take their 2-minute sleep quiz, and they'll match you to a customized mattress that will give you the best sleep of your life. Right now, Helix is offering up to $125 off all mattress orders. Get up to $125 off at helixsleep.com/howcome. That's helixsleep.com/howcome for up to $125 off your mattress order. Do it. All right, now back to Dr. Eid. Also, how cool that his name is Eid. Like, it's spelled E-I-D, but it's pronounced Eid because he's French. And Eid is like E-D, Eid. Hilarious. I don't think he'll find this funny. Okay, let's go back to the interview. How does the pump, like, you turn it on, obviously?
So the pump,
is there a button?
It has a little bulb, and you squeeze the bulb. Each time you squeeze the bulb, it puts 3 cc's of saline into the shaft of the penis.
Where does the bulb live?
It's behind the testicles, underneath the skin. So it's what a gentleman can do is just feel for the
balls.
pump, and then pump the scrotum. Yeah, not the balls, because the balls would be painful.
Because not the actual little. Okay.
Yeah.
So is it the same saline that lives in there all the
and
time, and it just goes back and forth and back
exactly.
and forth?
Yeah, I've had some of these units last 20 years plus some. It's not, but if a patient uses it a lot, it will break down sooner.
Mm-hmm.
So
That makes sense.
Natural wear and tear.
Natural wear and tear.
Yeah, if you treat your clothes, if you wear them every day, they will fall apart.
Yeah, no, so that, because of that parasympathetic nervous system, right, men can have an orgasm without actually getting hard.
Yes.
Mm-hmm. And I had no idea that could even be.
I know. I
thing.
feel like from this podcast, we've learned about guys having orgasms and not coming.
Yeah.
And that was like a huge revelation, but I didn't know they could do it without an erection.
Yeah.
I
and
think,
and that's, a very small percentage of men who have erectile dysfunction are actually treated, very small percent, So we do about 31,000 penile implants a year in the United States, but the number of men who suffer from erectile dysfunction is more like 30 million.
yeah.
Wow.
And so it's not even 1% of the total, patient male population that doesn't respond to pills, And the reason is that they still get pleasure. They can still, have sex and have an orgasm and masturbate and have an orgasm and they can have oral sex. Some men are satisfied with oral sex. They don't need to have intercourse, so.
Do you think, besides still being able to get some sort of pleasure, that there's another reason men aren't being treated for ED even when they should?
Well, there are a lot of barriers, including fear, embarrassment, insurance issues, the cost of treatment. And men generally don't like to take pills. They don't like to go to the doctor.
Yeah.
So, it's unfortunate because we find a lot of other health issues. We diagnose high cholesterol, we diagnose diabetes. Sometimes the first presentation of a medical condition is erectile dysfunction. Coronary artery disease, there's an association between erectile dysfunction and coronary disease. Especially in men who have...
put your pride aside because it could...
It's a symptom.
It's a symptom of something else.
Yeah.
Yeah, it's interesting because we usually ask our listeners questions before we come and talk to a guest. And I was like, send us questions or whatever. And at first, nobody was sending us questions. And I was like, you guys, send us questions. What's going on?
Yeah.
And some of the guys were like, I'm so embarrassed. I don't want to ask the question. Some of the women were like, I can't even talk to my partner about this stuff. But it's like, you would talk to him if you thought he had pneumonia, right?
Yeah. No, it's true. I think there's a lot of shame involved on both ends. I was listening to an interview with this psychotherapist who's a sex therapist. She specializes in it. And she was saying how for men, it's super shameful, often from a young age. It's an erection is your masculinity or power or your sense of self often. And sex is so important to your life and pleasure and all that. But often in the bedroom, if a guy can't get an erection, the woman will take it very personally.
Sure. Yeah.
And the first thing she'll think, it's me. I'm doing something wrong. And often right after that, there's no communication. And it just sort of breaks down and gets worse and worse. And she was saying that's why there are a lot of sexless marriages and stuff. And
or they just break apart.
Because there's no communication.
It's just too hard to confront.
Right.
Yeah.
But it's just another body part.
Yeah.
I mean, we've made it so different that it's like, oh, you've got a penis problem or whatever. It's like, okay, well, you wouldn't make fun of me if I had a heart attack.
Right. Or for women, if a woman can't have an orgasm, no one should shame someone for that. No woman should be like, oh, he can't get hard. That's not...
Well, I don't even know if it's more of that feeling of insecurity. Like, we had people write in being like, what do I do if a guy loses his erection mid-tryst? I guess do the same thing that we would say for a woman. Keep going, resort to other stuff.
Yeah,
start kissing, ask them what they like. Stuff. There's other stuff. You don't have to just focus on, it's sleeping.
Yeah.
It's sleeping, so we can't wake it up now.
Yeah.
You can wake it up.
There's something else is when a guy develops erectile dysfunction, he becomes totally consumed by it because he thinks about it even when he's not in the bedroom.
Yeah.
So he'll be walking around and he sees an ad on a bus, he drives by, sexy ad, and he thinks I have ED. Or he's in a bar with friends, somebody makes a joke, about sex, and he thinks I have ED. So he goes to a movie, watches a movie, and romantic scene, I have ED. So it's constantly,
I totally understand that. Before I had my orgasm, that's how I would watch sex scenes, and I was like, well, that's never happening to me.
So what's interesting is when they get a penile implant and they have sex, the first thing they tell you, my mind is so free. I don't know what to think about anymore.
Yeah.
They don't tell you, oh, I had great sex, or it's like the impact on their
overall
entire
being
is far superior than just the moment of intercourse.
Definitely.
Yeah.
That's so cool to be able to give that to somebody too.
Yeah. So really, erectile dysfunction when you dig down is not about sex.
Yeah.
It's about
Well, because you can have the orgasm the whole time. Like it's not about the erection.
I wish I had
You can have
known
sex
that.
without an erection.
Yeah.
So it's really.
You can have sex without an erection?
Yeah.
Why do you do that? You just push it in?
You just stuff it in.
Okay, well, this was a very important conversation right off the bat, and there's nothing more true than the fact that guys are terrible at taking care of their health. Whether it's like a knee injury, back injury, or something worse, guys are usually more comfortable, like, rub some dirt on it. You know how in She's the Man, she's like, rub some dirt on it, you're a man. Like, they'd rather do that than see a doctor. Every guy that I've ever dated has let some injury go too far. And I'm guilty of it too. Like, I've had this lump under my butt that needs to be removed or looked at for such a long time. I can't believe I'm even saying this. But you know what? Accountability. It needs to be removed. But people are really neglectful about their health. And the same is true for erectile dysfunction. Studies show that 70% of guys who experience ED don't get treated for it, which is wild. Thankfully, though, Roman created an easy way to chat with a doctor online. With Roman, you can get medical care for ED, if appropriate, from the comfort and privacy of your own home. You can handle everything online in a convenient, discreet manner. Even though, like, shout it from the rooftops. It's so normal. So many people, but anyway, getting started is simple. Just go to getroman.com/HC. That's HC for how come, and complete an online visit. If your doctor decides that treatment would be appropriate, they can prescribe genuine medication that can be delivered in discreet packaging right to your door with free 2-day shipping. Ooh. So guys, go talk to the doctor. Erectile dysfunction can be tough to tackle, but it's really important to get checked out. With Roman, it's really easy to connect with a doctor. And I know it's annoying. It's annoying. Oh my God, here's another thing. I've got cavities. Remember how I was bragging? Like, I've never had any cavities. I have like 6, well, they're not full cavities, but I went to the dentist and she said they're baby cavities. So we're getting them treated, but I've only gotten 2 done and I've been putting it off. Don't put shit off. It's bad. It's bad for your psyche. And also if it prevents you from like getting off, like, you got to take care of it. So just go to getroman.com/HC to get a free online visit and free 2-day shipping. That is getroman.com/HC for a free visit to get started. Getroman.com/HC. Like, the hardest thing about going to the doctor is going to the doctor. You don't have to do it with this. If there like was something online that could diagnose you, wouldn't you want to do that? Like, you have probably your phone pretty close to you if you're listening to this podcast right now, or internet capabilities. If you're thinking, my dick hasn't been working and I want it to, I want that to change, go check out Roman. It can be a really quick fix to change your life. And you can talk to doctors and they can tell you if that's what you really need or if you need something else. But either way, you'll know and you'll feel better. And don't like rub some dirt in it or don't like wait it out. Like, it's not going to, things don't change by just letting them stay the same. You know, you got to be proactive. So go to getroman.com/HC. Okay, back to the interview.
But there's so many different types of touching. And that's what this psychotherapist was saying. Like, you can make someone feel loved and important. And not something I thought was so interesting was that she was saying you don't want to be like a caretaker to the man. You know, if he can't get an erection, sort of treat him in a motherly way, like a baby.
Yeah, like, don't worry.
Don't worry. It's okay.
Yeah.
Because that's not sexy. Then he doesn't feel
Yeah.
Yeah,
Like
and
a
you're
sexual being.
breaking that like sexual tension, like fun thing, like you're changing the personality. Like
Just touch somewhere else.
Touch somewhere else. Change it up.
Yeah. You know, guys get upset when the partner says, "Oh, it's okay."
Yeah.
You know, don't do it. You know, don't do it for me. They get really mad.
Really?
And it's because they realize that the partner doesn't understand that it's affecting him. It's, and if a guy gets an implant, it's not for her.
Yeah,
it's for him.
For him.
It's for him. You know, and so and that has another effect is that most wives and partner, they're fearful that their husband will make a decision that will harm him, and so they're afraid of infection and malfunction and all those stuff. So the wife tends to put the brakes a little bit, but when she realizes that it's for him, and then she changes completely. She says, "Oh yeah, I understand now."
Yeah.
And so especially in the patients after prostate cancer surgery or diabetes, where the erectile dysfunction occurred abruptly and early in their lives, and if she sees how it's affecting him, and then she'll empower him to seek treatment.
And you're operating on them sometimes after prostate surgery?
Yeah, most of the time. A lot of the time. Yeah.
Is there any correlation, one of our listeners asked, between masturbating a lot and prostate surgery? I mean, prostate cancer?
Prostate cancer.
Yeah.
I think, masturbation is actually good, So, there's a lot of shame around masturbation. But if masturbation wasn't available, I think people would probably go crazy.
Definitely.
But they would kill somebody.
It would be the purge every day in
The
New York
world would be
City.
a scary place if people couldn't do
Dumpster fires.
It would be really bad. You
Yes.
know? So anyway, I think masturbation.
So masturbation, never bad.
Never bad.
Okay, great.
Very good. And actually, there's some studies that show it decreases the risk of prostate cancer. So, and there's a lot of shame with masturbation in third world countries, and and also there are some religious taboos, that it decreases that it's against God, and stuff
Wasting
like that.
your seed.
You're wasting your seed.
Yeah.
So there's a lot of
No, there's more seed. I assure you.
Yeah. So no, I think it's good. And so for the prostate cancer patients, there's another issue that is tough, and that is when they reach an orgasm, they will leak urine. So that is something that sometimes we have to try to fix. We have slings and sphincters because that was damaged during the surgery, the prostate cancer surgery, and so that can be very embarrassing for a man.
It's a sling for the urethra.
For the urethra, yeah.
So that it doesn't.
So it doesn't leak. When they reach climax.
I don't even know if I'd be able to tell. There's so much liquid happening
Exactly.
already.
Yeah, you can't tell. Sometimes we'll tell the patient, "Don't tell your wife it's urine."
Yeah.
It's okay. It'll be fine.
Hashtag guy squirt too.
Yeah. It's sterile.
It's sterile, so it's no problem. When it gets to be a problem, is during oral sex. It can be a problem.
Yes, then she'll know.
That does sound like a problem.
The taste is different.
Yeah, and it's very liquidy, and it can be a problem if it's too much.
Yeah.
And then,
Or in daily life too.
Yeah, you're like waterboarding your wife. I didn't mean to be in your mouth. I'm sorry.
That happens to women a lot, like who've given birth.
Yes, exactly.
Yeah.
With
the
stress,
sling is similar.
Stress incontinence. Yeah, that's why you have a lot of ladies getting these mesh and other controversies with mesh recently.
It's the same type of sling?
It's the same type of thing, except it's a smaller piece of mesh, and it has better results, mostly because it's been focused, by doctors who know how to do the procedure.
There's this whole controversy going on right now. There's a women's sex toy company suing the MTA because they're not allowed to run their ads, but at the same time, they've got ads for ED.
Yeah.
Was it a similar difficulty when you were starting out that people maybe didn't want you to advertise, or it wasn't talked about?
Oh my God! When we first, so I participated in the clinical trials to develop Caverject, which is a penile injection a treatment that patients can buy in the drugstore, and so they asked me to go around the country with a baseball player called Catfish Hunter, famous baseball player.
He sounds like a catfish hunter, not a baseball player.
Yeah. So So catfish, not hunter, but catfish. So catfish had diabetes.
Okay.
And so catfish, so we would go to different radio stations in the South especially, and we couldn't say penis, we couldn't say orgasm, we couldn't say erection, we couldn't say anything. So we would say, when a moment of intimacy arises, you grab this injection and you put it in the member in question. You had to use words like this.
Like Danielle Steele novel words. Member.
And so it was difficult.
Push it into your throbbing part.
Exactly. Your intimate part. And
your secret place.
So we had to, but nowadays Facebook is very strict. You can't do anything on Facebook.
We can't even advertise this podcast because of the name. But
and it's really frustrating because it's a medical condition,
right.
and people have a great interest in it, and the Facebook population is aging, and we know demographically that those are the patients who are going to get erectile dysfunction and problem with sex, and so they would benefit from information,
Totally. If they're liking their own posts, they're probably suffering from ED.
I only now gotten friend requests in the past week from people 60 and up.
Really?
That's it.
That's your demo now. Charlotte's fan play.
It's true.
Yeah, the kids, the kids don't use Facebook anymore.
No,
it's amazing. They think it's not cool. And
speaking of which, you guys, we're starting a Facebook group. I'm not even kidding, for the Cumpanions, because they all want to talk to each other. So go check that out. We'll invite you all.
That's great.
It's so important to have these discussions, though, because so many people were writing in.
Yeah.
A lot of guys wrote to me being like, it's really important that you're talking about this because I have felt so alone. Like, guys can't really talk to each other about it even. Because from such a young age, people crack
toxic
jokes.
masculinity that they would make fun of each other. Hopefully now there's more conversation that they wouldn't, but...
Do you ever have people come in who have either gone to therapy to sort of deal with the psychological aspects of it?
Yes, many.
Yeah.
And some of the younger patients get frustrated because they realize that at some point it's no longer psychological.
It's physical.
And then on a rare occasion, we'll have a patient who will come in his mid-40s and say, look, I've done 20 years of psychotherapy. I know it's psychological.
Yeah.
But each time I'm in a bedroom with a partner, I collapse. Give me an implant. And I'll give a call to the psychiatrist, and the psychiatrist will say, yes, how long are you going to wait? How many, and those are the good years, those are your sexually active years where you should be being active sexually. You want to treat that patient. So we actually do a penile implant in patients who have only a psychological problem.
And that's really interesting because Viagra, like, those people have taken Viagra.
Oh yeah, they're all tried.
Like, so much. They've all tried it.
They've tried
the
shot.
You have these TV ads where you can get Viagra without even talking to a doctor. You can get it by a phone call, and they'll send it to you in the mail. And then all these patients have tried Viagra and Cialis, but all these medications work the same way. So if Viagra doesn't work, most likely Cialis or Levitra or Stenja will not work either. So.
And
why is that?
Yeah,
because they block the enzyme that takes away erections.
Okay.
That's how they work. So that's why you have to take it. You have to release your own chemicals to produce your own erection, and then the drugs Viagra, Cialis block the chemical that take
it away
your erection.
So it's just a prolonger,
exactly.
not an inspirer,
or a conditioner, if you want to call it.
I see. Okay.
That's
why you have to take it in advance. Viagra, you have to take it on an empty stomach because if you have food in your stomach, you won't absorb it.
Well, I take it first thing in the morning.
Yes, that's what people do with Cialis, the daily Cialis.
Really?
You take 5 milligram every day, and you don't think about it. No.
Do you think it's unsafe to take those if you're not prescribed by a doctor?
It's a good question. We don't know.
Okay.
We don't know because it does give you firmer erections, and so some of these erections are supra-physiological, and we don't know whether it's overstretches the flesh of the penis, and then maybe later on, without the drug, that person won't perform. When we did clinical trials, it was never on healthy patients. It was on patients who had erectile dysfunction. So, you really don't know the long-term effects of these medications.
Yeah.
I think they're safe, but I really don't know.
Yeah.
But I think it's so great that you're doing implants for people who have had psychological problems, because then, it's this amazing thing of, I don't even have to think about it.
Yeah.
It's just here and it's fixed and it's done.
Yeah.
And you can finally feel free in your mind for the first time. Because maybe the psychological problems are symptomatic of the physical problems. That you've always
produces
felt
more stress.
Inadequate. Yeah.
Also, we don't remove anything from the penis to put an implant. So the patient will still have engorgement of the glands, with arousal. The penis will stretch and feel fuller, even without pumping the implant.
Is the pump an enlargement too?
No.
Can it be?
It will enlarge the flaccid or the soft penis.
Yeah, but
so no.
No.
Nothing exists in the world to make the erect penis bigger.
Okay.
Really?
Or longer.
Or longer, yeah.
Okay.
Or
there are a lot of scams, but nothing real.
You hear that, guys?
Yeah.
A lot of scams.
A lot of scams.
Good to know.
Yeah.
Really good.
Yeah.
So
and you can really
no Swedish penis enlarger.
No.
Don't
No
listen to
pills.
Austin Powers.
I saw an advertisement for a pill that would enlarge, if a woman takes it, enlarge their breast, but if a guy takes it, enlarge their penis.
Oh, sure. Because that's the same thing.
it's someone in a deep Pornhub wormhole.
Yeah. Nope, I don't think those are the same things.
So you can't lengthen and you can't make it
girthier.
So you can make it girthy by injecting fat or silicone underneath the, so there are some cultures, for example, in South Korea, guys, when they go to the military, they get a circumcision and then they inject stuff underneath the skin of the penis. So they'll put little beads or a little star or a little snake or
little
or
flare
a ring
for your penis.
Yeah, so it's supposed to enhance a woman's pleasure. However,
ribbed for her pleasure with stars.
But when you ask, doctors in South Korea says, did you ever do a study asking women if this is
they
something,
like it?
if they like it? The reply is, in South Korea, we don't ask women their opinion, Dr. Eid.
Oh my God.
That's what
we just do surgeries to our own penises that we think they'll like, which is way less risky.
I'm offended, but thank you
for wanting to please us, but not caring if it does.
So there are now there are doctors in the U.S. who are starting to put these things underneath the skin of the penis. There's a doctor in California that does it, but it doesn't enlarge. It makes the penis look wider when it's soft, but it doesn't lengthen the erection.
And
I don't think you'd ever want to lengthen it anyway, because now all that we've learned about female pleasure is that it seems to be about the clitoris surrounding the vagina. If you were to girth it up, it would make it touch more, but lengthening would just get it to touch your cervix, and nobody wants that.
No, absolutely, yeah.
Yeah.
I tell that to I have patients who come in and the penis is 7 inches and they want it longer. I said,
what?
You're fine.
You're fine. She's gonna push you away, during sex. Yeah. So.
Yeah, you want to have sex with a 10-foot pole? I don't think so.
Yeah. long distance sex.
Pole vaulting.
Yeah.
Okay, hello, it's me again. We've been talking about a lot of penis-centric stuff this episode, and it's time to talk about stuff for the vulvas. And some of these things can also be used for penises, but specifically, vulva owners, do you want toys that can make you go, I think you do. I love penises, you love penises, but I've got a vulva, and I got to tell you about Sweet Vibrations again, because a lot of you have been ordering these toys, and a lot of you have been telling me that you're squirting for the first time, and I am here to tell you, congratulations. I am so excited for all of our first-time comers. And so many of them are happening with Sweet Vibrations toys. I always talk about this, but the perfect match is the thing that made me have my first internal orgasm. I was oozing from the inside out. And that's the thing, is that it's got internal and external stimulation. It is the perfect thing for that quote unquote G-spot stim. And blended stim. It's awesome. So many people have bought it. It is not shaped like a penis at all. It is long. It is beautiful. It is soft. It is smooth. All the Sweet Vibrations products are. They're gorgeous. But there's no penis head. So it's not, you don't got to think about the fact that maybe you're single right now and penises could be triggering, or you don't like penises, or you just want something beautiful, or you don't want somebody to find your toy that is shaped like a penis. This is a beautiful toy. All of the Sweet Vibrations toys are. The girl's best friend, Ben, actually held up before this trip, and because he thought that I was just going to, the plan was I was just going to go to DC for the night, for that one show. And then I was like, no, I'll perform at this wedding. And he was like, do you want to bring your toy? And I was like, thank you for the thought. I really would love to, but I'm going to be sharing like most of my living spaces with other comics, and I don't think they'd appreciate that. Fast forward to, I get here and Sarah Armour's got her giant vibrator. And I was like, oh shit, I should have brought mine. But yes, I wish I had brought the girl's best friend here. Amazing toy. I don't want to say suction because that's not what it is. It's air technology that you put on your clit, and boy, oh boy, is it fun. Also, it's got a vibrating handle, so if you want to turn it around, flick that another way, you can do that. They also have the Pixie, which is an amazing little clit toy. It's for those people who maybe need a little more softness. That's what we're trying to do on this pod, is just tailor all of your sex toys to you. You know, like not everybody likes ice cream. Not everybody's going to like internal, external stim. Some of you might be like, you know, I like baklava, but nobody had ever presented you baklava. Here's the baklava. Pixie is the thing that it's you put it around the clit, and I can't describe how it's shaped. It kind of looks like little devil horns, and then your clit goes between those devil horns. But like you get to feel the vibration instead of like having something directly on there, or you can put it directly on there. Everything is very, you can tailor it to yourselves. But everyone's different. Everybody's body is different. And the Sweet Vibrations toys, they really run the gamut. So if one of them isn't right for you, get another one. They are amazing, and you can get 15% off. Go to sweetvibes.toys, use our promo code HowCome, and experience all of life's pleasures alone or with a partner. A lot of dudes have been writing in, or penis owners, males, cis males, saying that they've really enjoyed the Sweet Vibrations toys that they bought for their vulva owners. And also, one of you wrote that you used a girl's best friend suction on a penis, which apparently was really enjoyable to that person. You go get them, you guys. I'm really proud of you. Again, go to sweetvibes.toys. Use our promo code HowCome for 15% off all of these toys that you have just heard about. Yeah, that's all I have to say. If you don't want to go to sweetvibes.toys, go to How Come Podcast, and that promo code will be there under our products that we work with, our partners page that we work with. And you can go there, and you can also go there to find all of our products that we mentioned on this podcast: Helix mattresses, Roman, ED meds, etc., etc. Also, before we get back to the episode, I just wanted to wrap up this West Virginia thing for as far as I know right now. So last night was supposed to be the comedy show, and it turns out that they had put the comedy show on the invitation. And one of the people attending the wedding saw the invitation. It was a child. He's 11. And it said, Sarah Armour and guests will be performing comedy. And he said, well, I'm a guest, so I should be able to perform comedy. And his mom asked the bride, and the bride asked Sarah. And all of us were like, yeah, let's do a kids' comedy show. And basically, Sarah just hosted a bunch of kids telling knock-knock jokes. And some of them were really fucking funny. I mean, the kid who signed up, he is going to go places. Shout out to Joey. He big-timed us, even, like, after his set. Like, we were like, great job, Joey. Like, is that your first time on stage? And he's like, yeah, first time. And, like, walked away. Total diva star in the making. But, yeah, that was a really funny thing. And we didn't even perform. So we'll see if we perform at the actual wedding tonight. But I'm telling you guys, I'm actually having a really fun time flying by the seat of my pants. And I really want to do more road stuff. So if you want me to come to your town, message me, let me know. I will tell Sarah and she'll set it up. Also, this is very far in advance promo, but we're going to be in LA at the end of September for a show. So September 21st, write down that in your little notebooks. We'll tell you more about it as we get closer to the date, but if you're in LA or you're near LA, plan to get to LA, September 21st, yada, yada, yada. All right, let's get back to this episode. I was going to ask some questions from the Cumpanions. They've got some really good ones. They've got some really silly ones. We'll see if we can answer them.
All good.
The first one is, does sex with a prosthetic penis feel different? And if so, in what ways?
It feels the same. Mm-hmm. It's very firm. Mm-hmm. We have patients who see prostitutes. Mm-hmm. And the prostitutes can't tell the difference.
Can't tell.
Yeah.
Incredible. But it feels the same to them. The sensation.
Yeah.
That's awesome.
That's amazing.
Yeah.
Is being circumcised just for looks or medically? Are there benefits?
It's just for looks.
Cool.
Yeah, just for looks. You know what's amazing about circumcision? I mean, I could talk hours about circumcision.
Yeah.
First of all, doctors who do the circumcisions have no idea how big the penis is going to be.
Ah.
So if a patient,
it's like getting a nose job before you're 16.
Exactly.
Wow.
They have no idea. So a lot of patients who are circumcised, their penis is buried. They'll have hair on the shaft of the penis. They'll have a web, scrotal web. They don't even know that the penis is buried because that's how they've been all their lives. Ah. And so the doctors don't know if the patient's going to have a 5-inch penis or a 7-inch penis. Has no idea. Mm-hmm. Yet they pull the skin and they cut as much skin as possible so that the glands won't be covered when the penis is retracted, even in the neonate, even in the, So circumcision drives me nuts because I have to deal with the patients when it's
been screwed up or something.
Screwed up, and then when to put a penile implant, I have to take into account the shaft that's deep inside the scrotum, and sometimes we have to release the web of the scrotum. Have to do a scrotoplasty, and it's something. So it's one of my little pet peeves.
Wow. So late in life circumcisions would be the way to go if you're going.
But again, it has a lot of complications, and you have to be very careful the way you do it and so forth, and then you get a scar near the glands.
Sure.
And so that can be a problem. The main reason circumcisions were started in the United States was, believe it or not, for posture.
Oh.
Because the way, very briefly, the way it started, this kid walks into the doctor's office and he's bent over because he has an infection in his foreskin. And so he's walking with his back hunched, and the doctor sees him, and he's a very famous orthopedic doctor at the New York Academy of Medicine. All this is documented. It's all documented.
This sounds like the start of a long joke. So a kid walks into the doctor's office, but the joke's on everyone.
Yeah. It is. And so what happened is the doctor sees it, says, "Oh, your Achilles tendon are too short. We're going to have to cut those, and we're going to give you electrical treatment. It's going to solve your back problem." The nurse says, "Doctor, can you take a look at the penis? It's inflamed." So he looks at the penis and goes, "Oh, we can't do any procedures before we do a circumcision. We have to do a circumcision." He does a circumcision. The kid comes back, and he's walking nice and straight. And he says, "My God, this solved the sacral neurohumeral pathways to the brain and the back, and it's excellent for posture." The teacher student who the kid couldn't sit still because he was in pain, he was fiddling in class. Now he can sit and concentrate. They reported, they said, circumcision excellent for behavior
posture.
and for concentration, and it helps. And so that's how it started in the United States, and it was in the late 1800s.
Wow.
And it's all documented.
Wow.
So it was for posture and for behavioral reasons. It made docile.
I've got ADHD. I need a circumcision.
The exact words. It made for docile, compliant males.
Wow.
All males should be circumcised.
Huh.
Yeah.
This companion wants to know: is blue balls really that bad?
Do
you know what blue balls are?
We call it DSB.
DSB.
Yeah,
What's
deadly
that?
semen backup in medicine.
Deadly semen backup.
Yeah. No, it can be annoying.
Mm-hmm.
Can be annoying for you.
Annoying, but not unhealthy.
Yeah.
Yeah.
Probably, yeah.
I don't know. I grew up thinking like you got to help them. Like they're going to explode.
So
well, that's what they want you to
That's
believe.
what they want you to think.
Right.
Yeah.
Like we get blue balls too.
Totally.
You know?
Yeah.
This person says, what happens when a penis breaks? If you are heavier than the guy, can you hurt him?
Either heavier or thin. If you go up and down, and it comes out of the vagina, and it hits the pubic bone
And it
on
bends.
its way in, and it will crack. You will hear a crack, and it's called penile fracture. It happens also sometimes doggy style. We had a patient, for example, who was having an affair with a woman in his office, and they were having sex doggy style, and he got too excited, pulled out. When he came back in, hit the desk because she was bent over the desk.
God.
Oh my
Penile fractured,
God.
yeah. And then what happens is they get a huge hematoma, and the penis gets buried in this, gets a big black and blue. And you have to take him to the OR. You usually find a hole, and you have to close the hole.
And then you have to tell his wife that you've been fucking your husband
Yeah.
when she meets you
Or
at
you
the
can't,
OR.
you can't say anything.
Can't say
Oh
anything.
my gosh.
Well, that sounds
Yeah.
like karma for that penis.
Yeah.
Wow. How do you heal after that?
It heals.
on its
It
own?
heals. It can form a scar, or the patient can have an hourglass deformity where the penis will be a little bit narrow where the fracture occurred. It can even make the penis shorter. So
Hourglass figure.
Yeah.
Not the
Well,
kind
also,
want,
if you
though.
do the implant surgery incorrectly, a lot of the time you can lose
If
right?
if you don't size the patient properly.
Yeah. But you're not doing that.
No.
You're the best.
No.
He's the guy.
We
You're the
go
guy.
through a lot of stuff to not lose length.
Yeah. Does caffeine affect ED?
No.
No. What is something that you wish women understood about male genitalia?
It's a great question.
Yeah, thank you, Companion Bumblebee.
That they're very attached to their genitalia. Yeah. I would say women don't understand that when a man has erectile dysfunction, he thinks about it.
Yeah.
I wish all women would know that. But guys who don't have ED also don't understand that men who lose their erection think about it all the time. Yeah. So unless, and it's true for a lot of medical conditions, unless you have that disease or unless you have diabetes, you have no idea what it is to have diabetes.
Yeah.
And so that sort of limits our empathy for
Right.
people, because you really don't know. That's the greatest gift in medicine is you get to find out things about people that are very intimate, and then you realize, oh my God, I have no idea this person had this.
Yeah, I was going through that.
Was going through that.
Yeah.
Do you have any recommendations for people with partners who are struggling with ED?
I think encouraging them to seek treatment. And then also
And being like, it's normal.
Exactly.
It's fine.
Yeah, it's fine. It's just.
And I don't take it as an affront to me
Yeah.
that you're not attracted to me. I
Yeah.
get it.
Yeah.
This listener says, what can be done for men who come too soon? Is it because I'm so hot? LOL.
Absolutely.
It is. It's because you're so hot.
Yeah. Well, we always try to tell women that 1 minute is a long time, except that most of them don't buy
We're
it.
just operating in different universes.
Yeah,
In your
exactly.
universe, time moves
Yeah.
much slower than
Different time zones.
Yeah.
No, but premature ejaculation is an advantage, because you have to think, okay, how did people used to have sex? First of all, you didn't have private rooms. You were in a room with grandma and grandpa and the kids,
Or a cave.
or a cave.
Yeah.
And so you had to get your thing. Whoever was able to have intercourse and ejaculate quickly and get the partner pregnant was going to reproduce.
Evolution. Yeah.
Guys who took forever, the lion would be eating them by that time, before they would, ejaculate. So you have to think of premature ejaculation as sort of an advantage.
Yeah.
2000 whatever is no longer an advantage. You want to try to last as long as possible to please.
Did you forget what year it is? It's 2019.
2019.
He's like, I'm very busy. He's like, I've been back to back in this office since the 7th. Yeah.
Something.
And so what happens, a lot of it has to do with anxiety.
Mm-hmm.
So, a lot of guys are anxious about coming too soon. And so we treat that with medications that are called selective serotonin reuptake inhibitors, like Paxil, Zoloft, Lexapro. And it does help. Yeah.
But those are different than SSRIs.
They're SSRIs.
Those are SSRIs?
Yeah.
That's exactly what that stands for.
Yeah. Selective
But I thought
serotonin.
SSRIs make you less horny.
Yeah. They decrease your libido.
They decrease your libido.
But also they decrease the anxiety. The nerve centers, the cluster of cells in the brain that controls pleasure is very close to the cluster of cells that causes anxiety. And so, so if the chemical...
You're too excited. That makes sense for a premature ejaculator. Yeah, you make them
too
less
anxious.
horny.
Yeah.
Okay.
Now, the problem is long term. What happens long term, we don't know if. Now, if you take SSRI for, psychological reasons, if you have a lot of anxiety, a lot of these patients will complain that when they have an orgasm, they don't know that they have an orgasm.
They're just like,
disconnects your brain from your penis.
Oh, that's no fun.
And it's not fun. And some will even complain that after they stop the SSRI, it never goes back to normal.
Boy.
So that's why you got to go to a specialist.
Yeah.
Because
you go to a specialist.
You can really mess stuff up.
Absolutely. Yeah.
And the infection rate.
And the infection rate. Yeah. We're big about RID. There's a lot of infections living in hospitals. We've had friends who have gone into hospitals for like routine things and died of a staph infection, you know. So go to a specialist if you're having
definitely.
We the penile implant is not performed in the hospital for those reasons.
Yeah.
We like a clean ambulatory surgery center and send the patient home right away.
That's really interesting.
Yeah.
I don't know if we're allowed to ask this, but we ask it to all of our guests. Do you remember?
I'm afraid.
Don't be afraid because we can always cut it out.
Yeah.
But do you remember your first orgasm?
Oh, I was very young.
Yeah.
Yeah.
Not a memory making thing.
No, I was probably in my 12 or 13. Yeah, masturbating. Yeah.
Had anybody told you about it?
No, I was trying to figure it out on my own and talking to other guys, basically.
Yeah.
Guys talk, and. Yeah.
Is it because you're not from America? Is that more common?
In those days I lived in Brazil.
Okay.
And all the Brazilian, we would play soccer, and then guys would, eventually talk about stuff. Yeah.
Cool.
I feel like that's most of
you
the guys.
You learn from your friends, I guess.
Sometimes.
And older.
I guess I just didn't have any friends, guys. That's what this whole podcast is Remy has no
one was
friends.
telling me this.
Did you tell your friends after it happened?
I don't think so.
No.
Yeah, no. Yeah,
like, this is
I don't
for me.
remember.
Yeah.
Yeah.
Cool.
I was too busy doing it.
Exactly. Once you figure it out, you can't leave your house for a while.
Once you pop, you just don't stop. All right. Well, this has been so fun. It's such an honor to be able to talk to you and ask us all of our stupid questions.
No, they're great questions, and I hope that they help people,
Thank you.
Yeah.
Can you tell all of our listeners where they can find you online?
Yeah, so it's urologicalcare.com. And...
.com, not
yeah,
com.
Yeah. Perfect, right?
And then I know a lot of people asked this. How expensive are we thinking for surgeries?
So, Medicare, penile implant procedure is the only ED treatment that is paid by Medicare.
Wow.
Whoa.
And so when something is paid by Medicare, because it's been around, since 1973, most insurance carriers will also pay for it.
Wow.
So it's very rare, unless there is a rider or an exclusion in the contract, most will pay for it. If it's not paid, it can be expensive. We're talking, $20,000-$30,000.
Okay. Well, we have to ask this to every guest on every episode after a sexual experience, which this has been. Dr. Eid, did you finish?
I'm never finished.
All right. Well, we don't love to hear that, but it's great. And yeah, we'll have extras on the Patreon with more of your questions if you guys aren't finished either. Charlotte, did you finish?
Probably prematurely.
Okay, great.
What about you?
Oh.
I finished all over this beautiful office. Dr. Eid, thank you so much for coming.
Thank you. It's a pleasure meeting both of you, and I really enjoyed myself.
Such a pleasure. And you guys, we'll see you next time on How Come.
See ya.
Bye.
Bye-bye.
It's not you, it's me. I try so hard to finish honestly. They say you'll know when you go all the way from A right down to O. Oh no, I think that I still got a ways to go. Oh, I'm sick of this and I have got to know. How come? How come? How come I can't achieve? How come I can't achieve? I'm rolling up my sleeves. I'm rolling up my sleeves. Oh baby, I believe these guests can help. 'Cause I can't do it by myself. I wanna jizz